So welcome to this class. Again one more class. That is the vasodilators. That's leads from pharmacology. That is the vasodilators. Clear? Vasodilators. Clear? Vasodilator. The vasodilator is three types. One is the arterial dilator. Second one is venodilator. Third one is the mixed dilator. Yeah, it is the three types. Arterial dilators. Second one is the venodilators. Third one is the mixed dilators. Clear? The vasodilators are the three types. One is the arterial dilator, second one is the venodilator, and third one is the mixed dilator. So the venodilator and mixed dilator, the two are dilates veins. Yeah? The venodilator and the mixed dilator that dilates the veins, yeah? Not artery. So the venodilator and mixed dilator, the side effect is the side effect is the postural hypotension. Clear? Postural hypotension. The venodilator and mixed dilator, the side effect is the postural hypotension, also called the orthostatic hypotension. Also called the orthostatic hypotension. The postural hypotension, or also called the orthostatic hypotension. Then we go forward to the vasodilator drugs. Yeah, vasodilator drugs, and what is the mechanism of action? First one is the isosorbide dinitrate. First one is the isosorbide dinitrate. Clear? That is a vasodilator. Clear? That is used in long-term management of angina patient. Yeah? The isosorbide dinitrate is a vasodilator that used in the long-term management of angina patient. What is angina? Angina means the chest pain. Clear? Angina is the chest pain. Chest pain due to arterial blockage, the chest pain occurs, that called the angina. So the vasodilator that dilates the artery, so that called the pain has relieved sometime. So that the isosorbide dinitrate is used. Then, then the another vasodilator is the isosorbide mononitrate. The isosorbide mononitrate, that also used in long-term management of angina. Yeah. The another vasodilator is the isosorbide mononitrate. Isosorbide mononitrate, that also used in long-term management of angina. Long-term management of angina. So the angina is occurs is due to the atherosclerosis in artery. What is atherosclerosis? That means the narrowing of artery, so that the adequate amount of blood flow that not occurs in the heart, so that the pain has occurs. That causes the angina. Yeah, angina. Angina mainly is due to the atherosclerosis, means the narrowing of artery in our heart. So in isosorbide mononitrate, the alcohol avoided. The patient who is used the isosorbide mononitrate, you should instruct the patient to avoid the alcohol. To avoid the alcohol. Then the nitropside. Nitropside. The nitropside is used in the hypertensive emergency. Yeah. Nitropside, it is used in the hypertensive emergency. Hypertensive emergency or hypertensive crisis. So the in the nitropside is used in the nitropside is it is used in the hypertensive emergency. Hypertensive emergency. If the BP will be raised very high, in this case we should use the nitropside intravenously. Yeah? If some person the BP will be very high, in this case we should use the nitropside intravenously. The nitropside is the photosensitive. The nitropside is photosensitive. So that avoid light. The nitrous side is photosensitive, so that we should avoid light means the nitrous side should not be kept in the light, direct sunlight. The nitrous side uh, side is not kept in direct sunlight. Yeah? The nitrous side is photosensitive. It is the photosensitive. Yeah. So that avoid light means nitrous side is not kept in direct sunlight. Direct sunlight. Then we go forward to the AS inhibitor. AS inhibitor, that is angiotensin converting enzyme inhibitor, that is AS inhibitor. And the AS inhibitor. AS inhibitor. The AS inhibitor is the enalapril, captopril. The AS inhibitor is the enalapril, captopril. The AS inhibitor drug, AS inhibitor means the angiotensin converting enzyme inhibitor. The enalapril and the captopril are the drugs under the group AS inhibitor. Under the group AS inhibitor. So, the AS inhibitor drugs or the enalapril or captopril should be given 1 hour before food. Given 1 hour before food. 1 hour before food. The AS inhibitor should be given 1 hour before food. 1 hour before. The AS inhibitor, especially it should be given in the morning time. That is the preferred time to give them. Yeah. That is the enalapril and the captopril. So the AS inhibitor we should give him if the patient have hypertensive plus diabetes mellitus plus CKD. If the patient have hypertensive with diabetes mellitus with CKD, chronic kidney disease, in this case we should administer the AS inhibitor. If the patient have hypertensive, diabetes mellitus and the CKD, then we should prefer the angiotensin and converting enzyme inhibitor group drugs, that is the enalapril and the captopril. Then AS inhibitor contraindication means which case we should not administer the AS inhibitor. Contraindication. contraindication. First one is the bilateral renal artery stenosis. Second one is the pregnancy. Second one is the pregnancy. We should contraindicate or should avoid or should we do not administer the ACE inhibitor in which patient? In the bilateral renal artery stenosis, and second one is pregnancy. In this patient, we do not administer the ACE inhibitor. Clear? What is stenosis? What is stenosis? So remember one point. Stenosis is the word that comes. The stenosis means The stenosis means that is the abnormal narrowing. Abnormal narrowing. Stenosis means the abnormal narrowing is called the stenosis. In case we do not administer ACE inhibitor, then pregnancy. If we administer the ACE inhibitor in pregnancy, that causes the congenital fetal malformation. So that we do not administer ACE inhibitor in pregnancy. So that this is all about the vasodilators. So next class we'll discuss the another pharmacological topic. So thank you to all.